Hello, everyone, and welcome to Menopause Science. My name is Jyoti Sharma. I'm a health sciences researcher, CEO, and founder of TaraCares. TaraCares is an AI health tech startup committed to addressing unmet global health needs in menopause awareness, diagnosis, and management of menopause with artificial intelligence. Menopause Science is an initiative launched by TaraCares to offer evidence-based knowledge on various aspects of menopause transition. Today, we are privileged to be speaking with Dr. Vikram Talaulikar. Vikram, welcome to the show. Dr. Talaulikar, MD, FRCOG, PhD, is a respected specialist in reproductive medicine at University College London Hospital. He is a certified menopause specialist by the British Menopause Society and is also an honorary associate professor at UCL. Dr. Vikram is a principal trainer for FSRH, Menopause Special Skills. His research so far has been focused on fertility, early pregnancy, embryo-uterine interactions, and post-reproductive health. And like the team at TaraCares, he is equally passionate about education on menopause for women to take charge of their long-term health. Vikram, welcome to the show. Is there anything you wanted to say before we start the show?
Thank you so much, Jyoti, and thanks to TaraCare for having these modules done and recorded. So it's a pleasure to be part of this program. Thank you.
Thank you, Vikram. And for the viewers, as testament of our commitment, we are recording this on a Saturday, so you can imagine how passionate Vikram and I are. A disclaimer for the session. Participation in this session is voluntary with no commercial benefits to the company or the participant, and the sole purpose of the session is to help women of all ages to prepare and manage menopause transition. Data consent to record the session and air on YouTube and other marketing channels has been granted by the participant. We are not offering medical advice through these sessions, and the content is intended for educational purposes for self-driven healthcare during menopause. On today's session, we will be covering various aspects of the menopause transition. We will discuss the various stages of menopause, understanding the menstrual cycle, diagnosis and symptoms of menopause and its impact on long-term health, as well as what is the choice and options that women have for managing these symptoms, both hormonal and non-hormonal. And we are completely delighted to have Vikram share his knowledge with us on these topics. So Vikram, let's start with the stages of menopause. As you're aware, TaraCares is doing international research with women in lived experience of menopause. And one of the things that women are often confused with is the terminology that's used to describe menopause. Could you help us demystify the various stages of menopause transition? And for our viewers, for the purposes of today's conversation, we are discussing the use case of a naturally healthy woman, because we know there are different types of menopause. So Vikram, over to you.
Thank you, Jyoti. And it's interesting to see the data that's coming out of the TaraCare research, both in terms of people's experiences, but also the wide range of or variation in experiences they're having with their menopausal transition. Well, if we start with the types or stages of menopausal transition, then let's focus, as you said, on the natural menopause first. So it's expected that most women will go through perimenopause, which is the first sign of hormone fluctuations around the age of 45 to 50. But that's mainly for the Western world, and will come later on in the discussion about when does menopause happen for each individual. But generally, the perimenopause is the first stage that women will experience some changes to their menstrual cycles, some menopausal symptoms, as well as their hormones will fluctuate in the blood. And for majority, that will be 45 to 50. Now, what was happening before this was that a woman would generally have a very regular menstrual cycle. Periods will be very regular, and there will be no symptoms of menopause. And again, we'll touch upon symptoms a little later. After 50 or 51, women will stop periods, and the symptoms will either become pronounced or they will continue to bother the woman. So this is when we say menopause has happened. So from perimenopause, which was going on for a few years, you then have menopause, which is like a finite point. Now, it's always a retrospective diagnosis, because you can't say a woman has attained menopause until she has been period free for at least 12 months. So sitting here, I can't say if you're going to be menopausal or you're not going to be menopausal to a woman unless I know her period history. And it's 12 months of not having periods. That's the point we say, yes, this is menopause now. And from that point on, that 1 year of absence of periods until the end of her life, the entire phase is post-menopausal. So those are the three key terms which are sometimes confused. The perimenopause, when things are going up and down. Then you have menopause, 1 year of absence of periods. Post-menopause, right from that point on until end of life.
Amazing. That's very clear. And, as always, Vikram, in your very easy to understand way. So thank you for that. I think the next related subject, and you touched on it a little bit, is the timing of menopause. It's a controversial topic. We've seen women say that they were dismissed by their healthcare provider because they were felt that it was too young for them to be experiencing those symptoms. Could you help bust some myths and the importance of individual differences and factors? You mentioned one, the period history. Could you help us demystify that a little bit, and so that our viewers can be aware of some of the important key aspects about when these transitions could start for them?
So it's a key observation that age at menopause differs across the world's different populations, ethnicities, and to be honest, we still don't fully understand why that happens. So one has to be honest to say we're not there yet in terms of scientific research, and a lot is still yet out there to be known. What we know is for most Western populations, Caucasian population, the average age at menopause is around 51. And a range of normal age of menopause would be anywhere between 45 to 55. So it's about those 10 years. Now, that's true for Western population. If you look at African populations or Southeast Asian population, Indian, for example, where there have been some long-term and large studies, it looks like the age at menopause is almost 5 years earlier, which is around, say, 46 or 47. Now, other populations may still have other age at menopause, and we still have to do more research on that. What transpires is, why does this happen? So this is mostly down to genes or ethnic variation. And that's because many of the daughters find that they have menopause at a similar age to their moms. It's not 100%, but generally that's the rule. So it looks like there is a heritability or genetic tendency that determines when the age at menopause would be. But of course, there is influence from other factors. So we know, for example, socioeconomic background, nutritional status, whether a woman smokes or not, whether she's exposed to some toxins at her workplace, the environmental stress, all those could have some or a little or more bearing on the age at menopause. And therefore, there are still factors out there which probably haven't been discovered how much impact they have. But we know that it's not just the gene, but a bit of environment can also have an influence on the age at menopause. Now, just two more points to raise there. Women between 41 to 45 who have menopause in that age group or stop periods completely, we term that as early menopause. So anywhere between 41 to 45 is early, which will happen to about 10% of women. And women who have menopause before 40, that's premature menopause or premature ovarian insufficiency. And as you rightly said, there's no age where menopause is too early to happen. So we see girls soon after puberty or women in 20s and 30s who sometimes get diagnosed with premature menopause. It's very challenging. It's a very difficult diagnosis to handle at such a young age. Has lots of implications for future health and fertility. But it is uncommon, maybe 1 in 1,000 at the age of 30, but it can happen. And so it's really important to make sure that the diagnosis is done early so that these women get the right help and support.
Right. And I think related to that, Vikram, as you mentioned, like for the Indian population, for example, it happens 5 years earlier. Now, it's important to break that down for our viewers, that if your menopause is, say, happening at 45, that's 1 year of period free. which means if we consider just the simple math of 7 to 10 years transition, you may start seeing and experiencing these symptoms in your mid-30s, right? And we've been interviewing quite a few women who were absolutely shocked when they started experiencing these symptoms right after their first pregnancy. I mean, we are in a day and age where almost feels like around 32, 34 women start thinking about having their first child. And for us at TaraCares, it's so critical that we empower women with this knowledge, because they may have to reevaluate their reproductive decisions, if they want to extend a family. So that was very, very helpful.